this is part 2 of this case study. So basically the weaknesses: lack of demographic information, only enrolled patient in moderate glycated hemoglobin levels of 6.5 to 8.0%, only enrolled patients 50 years of age and greater, and also results in this study can be used to predict risks and benefits of longer durations of therapy or in patients with more complicated comorbidity. The summary of the primary literature. The primary literature mentioned in this article has similar results in this study. The Sitagliptin assessment of vascular outcomes recorded in patients with diabetes mellitus and thrombolysis and myocardial infarction 53 Savoy TIMI 53 trials, and the examination of cardiovascular outcome versus standard of examine trial both showed that DPP4 inhibitors did not increase or decrease the number of cardiovascular events. In contrast, the study, the Savoy TIMI 53 trial, resulted in an increase in the rate of hospitalization for heart failure, and in the Sitagliptin group and the examining trial shows an imbalance between the Sitagliptin group versus placebo groups. My conclusion was similar to the author's conclusion on this study. I concluded that based on the results of this study, using Sitagliptin in addition to usual care in patients with type 2 diabetes and cardiovascular disease, it did not decrease or increase the risk of cardiovascular events. Also, using the additional Sitagliptin did not increase or decrease hospitalization rates for heart failure and the risk of adverse drug events. Although this wasn't the best study, it did show that Sitagliptin can be used in diabetic patients who are at a high risk of cardiovascular events. Therefore, I would recommend using Sitagliptin as an added-on therapy in this patient population for additional A1C lowering. Thank you.